Hey guys, this is with Nursing School Made Easy. Today's lecture is going to focus on hyperparathyroidism. So, first of all, what do the parathyroid glands do? That's the first question we must answer, and then that'll make everything else a lot easier, I think. So, the entire purpose, main purpose of the parathyroid glands is to regulate calcium levels. Okay, again, the parathyroid glands regulate calcium levels. Now, the parathyroid glands sit behind the thyroid gland. So, there is my head there. You can have your neck, you can have your trachea. Remember, thyroid gland is going to be on there, like so. So the parathyroid glands will be behind the thyroid gland, so they'll be in the back, kind of like little dots, like so. Now, again, these are going to secrete parathyroid hormone, or PTH. Again, they're going to secrete parathyroid hormone. And again, this hormone is going to regulate calcium levels. So in hyperparathyroidism, you have an increased secretion of parathyroid hormone. Again, you're going to have an increased secretion of parathyroid hormone. Now, parathyroid hormone is going to regulate serum calcium by a couple of different mechanisms. Number one, it is going to cause bone resorption. Now notice that I said resorption, not reabsorption. Those are two completely different things. So let's make our person here a little bit bigger. Oh, before we get to that, let's talk about the second thing that it does. So that was number one, bone resorption. Number two, it is going to cause renal tubular reabsorption of calcium. So your kidneys or your renal tubules are going to, let me spell that right. Again, your kidneys, and more specifically your renal tubules, will reabsorb calcium. Now this is reabsorb. So there's two different things, resorption and reabsorption. So let's see what the difference is. So here we have our neck, shoulder, arms, chest. Inside your chest, you're going to have ribs, right? Or long bones. I'm going to say that those are my ribs. I'm going to have abdomen. You're going to have some legs. And those legs are going to have some femurs. So on and so forth. And tib, fib. So again, I'm oversimplifying things. So number one, your parathyroid hormone is going to come to your long bones, for example, your ribs, femurs, tib, fib, and it is going to cause calcium to come out of the bone and it come into the serum or into blood circulation. Okay, so again, it's going to cause bone resorption. It is going to extract calcium from the bone. Well, if you have calcium extracted from the bone, that is going to weaken the bone. Now, the other thing that it is going to do, we'll say that this is now our heart. Make it a different color. We're going to have our aorta, kidneys here. Now again, what this is going to do, it is going to cause the kidneys to reabsorb calcium. So anytime you drink milk, anything that has calcium products in it, or excuse me, any product that contains calcium in it, this PTH is going to come to your kidney, and it's going to tell your kidney, hey, keep calcium in. So you're going to have, again, large amounts of serum calcium. Well, if you have large amounts of calcium coming into the kidney, well, that predisposes this patient for kidney stones. The bone resorption makes it more likely for these patients to suffer from osteoporosis. But we'll get into that here in just a little bit. So we have a couple of different types of hyperparathyroidism. Number one, primary. In this case, in primary, you're going to have increased PTH secretion. Now this can be caused by a benign tumor, an adenoma. Now just thinking ahead here, if there's a benign tumor, it makes it very likely for this patient to undergo some type of surgery to remove that tumor. Now, this benign tumor, the cause for this may be some type of, or an increase in radiation to the head and neck. So a good example of somebody that gets exposed or increased radiation to the head and neck would be somebody like an X-ray tech. Okay. So again, that is primary hyperparathyroidism. You can also have secondary. Now in secondary, this is due to something like a vitamin D deficiency. Remember that vitamin D helps absorb calcium. So if you have a vitamin D deficiency, that's going to make it higher for you, or excuse me, make it harder for you to reabsorb calcium. Therefore, the parathyroid gland will begin to secrete increased amounts of parathyroid hormone. And this vitamin D deficiency could be due to some type of malabsorption. Or maybe it can be due to chronic kidney disease. Now again, the chronic kidney disease could be brought on by something like a diabetic patient who is non-compliant. Again, diabetes can go on for long periods of time. If the patient does not take care of themselves, they can run into some renal failure. And again, that would be chronic kidney disease. So this is why it is very, very important that we educate our patients that are diabetic to please take care of themselves, because they can run into lots of complications involving the kidney. Now another type of, or another cause for secondary hyperparathyroidism could be something like hyperphosphatemia. Remember that calcium and phosphate have an inverse relationship. So if calcium goes up, phosphate will go down. Well, if you have a scenario where you have hyperphosphatemia or increased levels of phosphate, that will result in decreased amounts of calcium. Again, your parathyroid gland, its sole purpose is to regulate calcium levels. So if it senses that calcium levels are low, it will begin to secrete parathyroid hormone, large amounts of parathyroid hormone, and bringing about hyperparathyroidism. So we talked about primary, secondary. Now let's talk about tertiary. Now this could be something caused by kidney transplant, or possibly induced by dialysis. Now, what will be some clinical manifestations, signs and symptoms that your patient will display that you will need to look out for? Number one, we talked about how the parathyroid hormone is going to cause bone resorption. It's going to cause calcium to be removed from bone. That will end in osteoporosis or bone weakening. So you must watch out. You must be careful with these patients, because these are patients that run risks of becoming, or of having fractured bones. So if you have this type of patient at your facility, you want to make sure that you institute fall precautions immediately. You give them some socks that have the grip underneath them. Make sure you move everything out of the room that can possibly cause them to fall. You put that call light as close to them as possible. You answer the call light as soon as you can. Okay. Number two, again, we talked about how the kidneys will be affected and how the kidneys will be triggered to continuously reabsorb or bring in calcium into the body. Therefore, these patients will suffer from kidney stones. Now, along with the kidney stones, they will also complain of or suffer from flank pain. So if these patients, patient comes into the clinic complaining of severe flank pain and they have some type of thyroid or parathyroid issue, you may suspect kidney stones, again, due to the increased calcium intake or reabsorption. Now, another thing to remember about these kidney stones is if they continue to get kidney stones multiple times, the kidney stones can actually damage the kidneys, resulting in kidney failure, kidney damage, chronic renal or kidney disease. Okay, so kidney stones, these are very important. You have to watch out for them. The other thing is you have to remember it is very, very painful. So make sure that if they do have some type of kidney stone, that you medicate them properly, because this is very painful. Number three, muscle weakness. Now this would be especially in the lower extremities. Now again, we have muscle weakness here, and you have a patient with osteoporosis. Again, make sure you pay very close attention to these patients. 4, renal failure. Again, a lot of this has to do with the constant damage caused by kidney stones. 5, you'll monitor for cardiac changes. Again, this is going to be due to the increased amounts of calcium in the body. It will cause cardiac changes, it will cause dysrhythmias. So if a dysrhythmia is suspected, you want to put these patients on telemetry. If they report any chest pain or palpitations, you want to, again, get a telemetry, or excuse me, an EKG right away. Number 6, these patients will also show decreased attention span. Now, in severe cases, pancreatitis can result. What are some diagnostic studies? Number 1, increased PTH or parathyroid levels. Parathyroid hormone levels. Number 2, serum calcium levels greater than 10. Now we talked about if calcium goes up, phosphate or phosphorus must come down. So serum phosphorus levels less than 3. The other thing you will look for is urine. Their urine specimen, their urine samples. You'll find increased calcium in the urine. Now we talked about how this may cause the patient to suffer from pancreatitis. If that is the case, you will find increased amylase levels, possibly increased lipase levels. Again, this is only if they are suspecting pancreatitis. Something else that can be done, maybe something like a DEXA scan. Now, a DEXA scan is a radiographic exam, and what the DEXA scan does is it basically checks the bone density. Now, most likely the bone density will be decreased, and that will be an indication of osteoporosis. Now let's focus on our interventions. Number 1, this is something that will be performed by the physician, of course, but a parathyroid ectomy can be performed, removing the parathyroid glands. Now, if this occurs, something will be done. You can actually do a autotransplantation of normal parathyroid tissue, and this can be in the forearm or in the sternocleidomastoid region. Okay, if, however, they cannot do the autotransplant, you must inform these patients that they will have to take calcium supplements for the rest of their life. Number 3, you must inform these patients that they still must ambulate, they must still exercise. Because again, you do not want to place these patients or you do not want to make them completely immobile. We've already established that these patients run the risk of suffering osteoporosis. So you still want to make sure these patients ambulate, walk frequently. You still want to try to get that bone as hard as possible. You don't want to do very, very heavy lifting because, again, you may cause a fracture, but you still want these patients to ambulate to get some form of exercise to prevent further weakening of bones. Number 4, you're going to tell these patients to increase their fluid intake. Reason for this is because, again, they're reabsorbing calcium, so you want to help the body, the kidneys, void or get rid of as much calcium as possible. You're trying to prevent those calcium deposits in the kidney. Again, you're trying to prevent kidney stone formation. So you're going to, again, tell them to increase fluid intake. You may, or the physician may prescribe something like Fosamax. Now, this is in hopes of increasing phosphate levels. Again, if you increase phosphate levels, you're going to decrease calcium levels. Now, you will only give Fosamax if the patient has adequate renal function. So you must assess renal function first. You must look at BUN. You must look at creatinine. Make sure those are within normal levels. And you must look at the GFR, glomerular filtration rate. These must all be within normal levels. That will indicate or give you indication of whether the patient has good renal function or not. Number 6, this is a big one. You'll monitor for tetany. Okay. Now, if you do not remember this, please watch the lecture on hypo and hypercalcemia, because you must know this for the NCLEX exam. Watch out for any tingling in the hands, any tingling in the mouth. You're going to watch out for, I still can't pronounce it, so I'll just write it out. For that, and also for Trousseau sign. So make sure you know the difference between both. Again, if you do not remember it, please review the lecture on calcium, because I guarantee you will see this on the NCLEX. Number 7, let's say the patient did have a the parathyroidectomy performed, the surgical procedure performed, the parathyroid glands were removed. Well, now the body has the likelihood of running into hypocalcemia because you removed the very thing that regulates calcium levels. Therefore, you have to watch out for low calcium levels. And if this is a case, if they become hypocalcemic, then you may give something like calcium gluconate. Now, depending on the severity of hypocalcemia, you may either give this PO or IV.